Public Health has issued a drug alert after a rash of overdose calls. With all the details, let's go live to CP24's Courtney Heels working on reaction to this. Courtney.
And Lena, we can tell you that Toronto paramedics responded to over 40 calls related to overdoses in the city. That's an incredibly high number, and it seems to really show what paramedics are responding to. And that's why Toronto Public Health say they're drawing attention to this issue. They say 3 fatalities also happened in the last 24 hours, believed to be connected to overdoses. There are no specifics when it comes to the type of drugs, but Toronto Public Health says there appears to be a range of substances from the unregulated drug supply involved. To talk more about this, let's bring in Nirmala Raniga of the Chopra Addiction Center in British Columbia. Nirmala, thank you for your time. I will start by asking you, is this a trend that you're seeing and that we are seeing across the country right now, an increase in overdose calls?
Thanks for having me. Yes, we have seen compared from 2019 going into 2020, we have seen increase in numbers, especially in BC. In the month of November, our numbers were doubled from 2019. And, just finding out, knowing that 3 deaths yesterday, that's one too many people lost to overdose addiction.
It is really concerning to hear of the high number of overdose calls in Toronto in the past 24 hours and the fatalities, as you mentioned. Why are we seeing this right now?
First of all, with COVID-19 and isolation has forced people to sort of go into spaces where they're using alone. In the past, we know human beings need connection. And addiction is all about isolation. It's about shame. There's this stigma around people using drugs. And we as a community need to understand that it's not the drugs, it's the person, it's that human being that is in pain. And we as a society, as a community, as a government need to do more to support those who are suffering. With the current crisis, when we are asked to be isolated, that we can't connect, even treatment centers like our center, we had to cut back on our intake numbers. Our outpatient clinics, same, that connection is not there, and this is further making the problem worse.
Mm-hmm. When you mention support, do you mean that there needs to be more support financially? Does there need to be more support face-to-face? How can we address this crisis? Because it has been an issue for quite some time now.
All levels, it has to be face-to-face. And, with the current crisis, we are asked to isolate. And a lot of the centers, treatment centers, probably outpatient centers, it's the same thing. There's been reduced number of visits. So we need to figure out a way to support more people to attend the programs in a safe way. That connection is so important. Also, on a financial level, I think most of the people may not seek treatment because there's a cost attached to treatment, whether it's private treatment, whether it's going into a clinic, because some of the clinics, I know in Ontario, it may be funded, but out in BC, some of the clinics are not funded. Mm-hmm. So it is, again, there's a cost. And also the community, we as human beings, we as people need to really support people who are struggling with addiction. Often the shame and stigma is the number one reason people don't seek help. And, those who are using, I really, really encourage and really need them to know that do not use alone. This is a killer. The opioid addiction, what is out on the street, is killing people. And we have too many people who have died over and over again when we look at all the numbers.
Nirmala Raniga with the Chopra Addiction Center in British Columbia. Thank you for your time and your take on this evening.
Thank you so much, Courtney. Have a good evening.
You too. And same messaging is coming from Toronto Public Health tonight, Lena, the fact that people need to be aware that this is happening in the community right now. And again, encouraging people who are using drugs not to do so alone. There is help and support out there, and also encouraging people to get their hands on a naloxone kit. This is something that can help reverse the effects of an overdose when it's happening. Over to you.